Okay, I want to talk about kidney failure. Kidney failure, of course, the goal of doctors is to get you on dialysis and get you up for kidney transplant. But remember, I'm a pathologist, and I used to look at kidneys removed from people who were getting a kidney transplant. And when you look at the kidneys of people who are getting a kidney transplant, the kidneys are taken from them, there's nothing wrong with them. What? Well, how come they had kidney failure? Well, I'll give you an example here. Let's say you're taking a shower, and the water starts rising up around your ankles and gets up to your knees, starts overflowing the tub. Are you going to call a plumber and say, hey, look, I need you to come and exchange the tub? I need a new tub. No. What you do is you lean down while the shower's running, and you just scrape the soap scum and the hair off the drain, and the tub drains, and everything's fine. The same thing is true when people have kidney failure. Their creatinine levels in their blood go up, which is kind of a measure of the ability to process protein, and their blood pressures go up because when the kidneys aren't happy, they release a hormone called renin, which drives your blood pressure up, trying to get more dirty blood into the kidneys to filter. And what happens here is, in reality, there's nothing wrong with the kidney most of the time, like 99% of the time when you have kidney failure, there's nothing wrong with the kidney itself or the filtering units called the glomeruli. But what is wrong is the little afferent arteries are 10,000 times smaller than the diameter of your hair, carry the dirty blood into the filtering units. They're only big enough for one or two blood cells to go through at the same time. Tiny, tiny little things, 10,000 times smaller than the diameter of your hair. And when they get plugged, two things happen. Blood pressure goes up because the kidney doesn't like being without the blood. It doesn't like to not do its job. So it releases a hormone called renin, again, to drive your blood pressure up, drive more dirty blood into the kidney for filtering. And so blood pressure goes up, often because of peripheral artery disease inside the kidney. And then, of course, eventually you start to have to get dialysis 4 or 5 times a week. Then they put you on the kidney transplant list. And for a while, everything seems to go okay. But if you don't change your lifestyle, the new kidneys go bad also. So what's going on here? Well, what's going on here is this. The little arteries in the kidneys, these little afferent arteries that deliver the dirty blood into the filtering units called glomeruli, are actually plugged by inflammation, not cholesterol. Cholesterol has nothing to do with it. Inflammation from eating fried foods, processed meats, trans fat. I was so glad to see the FDA ban trans fats, because that was going to be my 9th lawsuit against them, was the trans fats thing. Because we've known since 1971, 40 years we've known that trans fats and fried foods, processed meats with nitrates, nitrites, oils, margarines, mayonnaise, salad dressing, this is where most trans fats are. And then there's heterocyclic amines, burnt animal fats, and acrylamides, superheated carbohydrates like French fries and burnt toast and that kind of stuff, crispy crackers and crispy potato chips. These are the things that clog arteries. And the small ones, 10,000 times smaller than the diameter of your hair, are going to plug up first compared with your coronary artery, which is as big around as your little finger. Okay? So we came up with a system we call the Healthy Heart and Brain Pack, which delivers all 90 essential nutrients, particularly with a little extra effort designed to deal with the cardiovascular system, including the little afferent arteries in the kidneys. And then we throw in the Ultimate Daily Tablets. The Ultimate Daily Tablets are designed to support and promote healthy blood flow through obstructed arteries, even little afferent arteries in the kidneys, and also support and promote healthy blood pressure. Okay, and then I want you to get the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy. Go to your Youngevity associate and ask for the trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport to Aromatherapy, and you'll learn about kidney failure. You'll learn about what you can do about it. You have to change your lifestyle. No more fried foods, no more processed meats or nitrates, nitrites, no oils, no margarines, mayonnaise, salad dressing, cooking oils, no gluten, no wheat, barley, rye, and oats. And guess what? You take all 90 essential nutrients. You get the extra Ultimate Daily, which again are designed to support and promote healthy blood flow through obstructed arteries and support and promote healthy blood pressure. It's predictable. Even if you are not urinating, we get people who don't even urinate. They haven't urinated in 5 years. And on this little program, within a couple of months, here comes the first drop of urine that they haven't had in 5 years. And then in a couple more weeks, there's 10 drops, and then there's a teacup, and then there's normal urine volume because there's more blood flowing through those obstructed arteries. Okay? More dirty blood reaching the filtering unit. So now we're not changing tubs as the water's flowing over in the bathroom. We're just getting the dirty water out of the tub down through the drain system. Same thing works for your kidneys. In most cases, you can save your kidneys, and after months, you're able to wean yourself, or doctors will wean you off of your dialysis, and you'll be able to save your own kidneys. Or if you have had a kidney transplant, you certainly want to do this program and do a better job of taking care of your new kidneys than you did your original ones. Okay? And so remember, kidney failure, in most cases, there's nothing wrong with the kidney, so it's actually an incorrect name for the problem. What it really should be called is PAD of the kidney, peripheral artery disease of the kidney, resulting in lack of filtration, which shows through the creatinine levels in the blood. When it goes up above 1, get to 2, 3, they're going to put you on dialysis. I like to see your creatinine levels like 0.9. It's very doable. Changing your lifestyle, changing your diet, counting the 90 essential nutrients, ultimate daily tablets. Wow. It's amazing what works. Trilogy books, Let's Play Doctor, Let's Play Herbal Doctor, and Passport Aromatherapy. And you'll know more than your doctor does, which isn't hard. We'll be back after these messages. Okay, Doug, let's go to callers.
Let's head to Texas. And Julie, you're on with Dr. Wallach.
Hello, Julie, you're on the air.
Yes, thank you for taking my call.
Yes, ma'am.
Yes, I need some help dealing with scabies.
Okay, is this on yourself?
My mom has it, and now I think I might have it too.
Okay. And how's this manifesting itself?
With a rash.
Okay. Did you have asthma as a kid?
Yes, I did.
Well, there's a bingo, isn't it?
Mm-hmm.
Now, how did I get that out of just one question? I hit it on the head. Because I don't think you have scabies. Scabies are very easy to determine. What you do is you just take kind of like a tongue depressor, put a little mineral oil on it, and then just scrape the rash area, look at it under the microscope. Scabies are little mites. They actually look like ticks under a low-power microscope. Very, very easy to see. And so you can determine that like in 3 seconds.
Okay.
But I think you have a gluten intolerance. Okay? It's passed on by mothers to their daughters and sons. And daughters pass it on through the cord blood or breast milk to their babies. Boy babies get it, but they can't pass it on because they don't have pregnancies. Now, this is not unusual that people will have, when they have eczema, dermatitis, psoriasis, rashes, rosacea. Do you ever have this rosacea on your face, or is it just on your trunk or your legs or arms or what?
No, I just have it on one of my hands. Now, my mom has it on her legs and arms, but she was diagnosed with scabies.
Well, that doesn't mean anything. Dermatologists make a lot of mistakes.
Yes.
Yeah, especially when it comes to gluten. Now, did they do a skin scraping on her and look at it under the microscope, or they just said, looking at it says, oh, my gosh, this is scabies?
Well, I don't think they did the microscope.
Yeah, I don't think so either. They just look at it symptomatically, and they see big, dry, crusty things. And, oh, my gosh, this is scabies. And did their scabies treatment cure her?
No, it didn't.
Okay. Well, what Albert Einstein said, insanity is doing the same thing over and over and expecting a different result. So what I want you to do, and your mother, do you have any brothers and sisters?
Yes.
Okay. Do you have any children?
Yes.
Okay. Do any of them have any history of asthma or their appendix out or anything like that?
No.
Anybody else have skin problems? Eczema, dermatitis, psoriasis, rosacea?
No.
Okay. Well, hang on. I'm going to tell you what you can do after these messages. In fact, I'll get Shar to do that after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Longevity and 90 for Life Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. Again, that's toll-free, 1-888-379-2552. And if you suspect you have a gluten intolerance, have you ever been diagnosed with things like diverticulitis, appendicitis, celiac disease, irritable bowel syndrome, inflammatory bowel disease, colitis, ulcerative colitis, Crohn's disease, eczema, dermatitis, psoriasis, asthma? You have a gluten intolerance, and these are all symptoms of nutritional deficiencies because you lose your ability to absorb efficiently when you have a gluten intolerance. You can regain it by getting on a gluten-free diet. So what I want you to do is contact your Young TV associate and get a hold of that book called Hell's Kitchen, the book. Hell's Kitchen, the book, deals with that. Also, I want you to get a hold of that CD called Serial Killers. take on words, serial killers. And, of course, it tells you all the hidden places you're going to find gluten. Save yourself. If you're gluten intolerant, you'll add 25 to 50 healthy years by getting on a gluten-free diet and supplementing with the 90 essential nutrients. Okay, Doug, let's go right back to Texas and Julie. Okay, Shar?
Yes.
Did you listen to this whole conversation I had with Julie?
Yeah, she's definitely got a skin problem from a gluten intolerance.
Okay, what would you tell her to do for this?
She's got to get on a gluten-free diet immediately,
okay,
and it'll probably go away within a week or so.
Okay, and what would you supplement her with?
Because of the gluten problem, I would give her the classic and the... Don't you think?
Yeah, I'd go with the classic. And Julie, what do you weigh?
130.
Okay, 130. And so I'd give her 1 ounce of the Ultimate Classic per day, and a tablespoon of breakfast and dinner. That's a half ounce of breakfast and dinner, so 1 quart will last her a month. And what else would you give her?
Can she have? Is that osteo powder? That's free of shellfish and everything, isn't it?
Yep.
So it's the liquid now, I think.
Yeah, I'd actually go with the Cal Toddy. Just
give her Cal Toddy?
Yeah, I'd give her Cal Toddy. I'd give her an ounce a day.
The Women's Omega?
Yeah, it's actually the name. You're exactly right there. The Women's Omega. The name has been changed to Multi-Omega. It comes from evening primrose oil. It's all from a little plant they grow in Canada specifically for this. And asthma, skin problems go away very quickly. And you're exactly right, Shar. It used to be called Woman's Omega, but men didn't want to take it because it inferred it was only for women. So we changed the name to Multi-Omega, and that way men feel comfortable in taking it. But the warning I would give Julie is all her siblings, all of her nieces and nephews, and her mom, if she's still alive, have to get on a gluten-free diet, including the dogs and the cats and the canaries and the fish and anybody else in the house with her. Okay, give us a call every couple of weeks, Julie. People like to hear how well you're going to do. Okay, Doug, do we have time to start another one?
Yeah, let's head to Santa Cruz, California, and Geneva. You're on with Dr. Wallach.
Oh, Geneva, you're on the air.
Hi, Dr. Wallach.
Hi, how can we help you?
I have a customer who has a knee problem. She says she has a torn meniscus. There's no cartilage. Says it's bone on bone, and of course the doctor says she needs knee replacement surgery.
Okay, how much do you think she weighs?
She's 150.
150. Okay, Char, what would you do for this lady with bone on bone and torn meniscus?
She needs a healthy bone and joint pack. She needs probably 2 of them. I would go with 2 for a while until she loses some weight. If she needs to lose weight, I don't know.
Yeah, well, I'd go with 2 because she has bone on bone, and the doctors are pushing her for double knee replacement. Yep.
Yeah, remember the lady we had that had her meniscus removed from a car accident, and she grew a new one back?
Yeah, so we actually have many people who have regrown their meniscus even after they were surgically removed, as long as they didn't cut the bone in half, remove the bottom half of the femur and the bottom top of the tibia. As long as the bone is still there and they just surgically removed the meniscus, we actually have had them regrow with a healthy bone and joint pack. Now I'd go with 2 of those, give her a full dose of everything at breakfast and dinner. That would allow her to have 15 glucogel a day, 5 at breakfast, lunch, and dinner. The raw materials to support and promote maintenance, repair of cartilage, ligaments, tendons, connective tissue, disc between the vertebrae, bone matrix, and bone itself. We'll be back after these messages. We're back with Dead Doctors Don't Lie on the ZBS Radio Network. Dr. Joel Wallach here for Youngevity and 90 for Life Crusade. We do have lines open. Give us a call toll-free, 1-888-379-2552. With all this confusion about the Affordable Health Care Act, it's time that you began to take care of yourself. Your doctors have failed you again. So what I want you to do is get a hold of that trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy, and learn how to deal with over 900 different diseases with vitamins and minerals and trace minerals and rare earths, amino acids, fatty acids, herbs, and aromatherapy oils. It's a trilogy of books, Let's Play Doctor, Let's Play Herbal Doctor, and the Passport Aromatherapy. Once you learn how to do these things for yourself, I will pay you an obscene amount of money to actually do them for other people. Gosh, what a concept. Help other people and get paid for it. Okay. Doug, let's go to callers.
Oh, let's head to Utah. And Pam, you're on with Dr. Wallach.
Pam, you're on the air.
Hey, Dr. Wallach. Pam Crockett here. I was able to see you at the Pocatello, the Boise, and the Logan, Utah.
You're officially a groupie. How can I help you?
Yes, I have a brother-in-law that has Lou Gehrig's disease, and we've put him on 2 of your healthy brain and heart packs, and you told us to put him on 12 eggs a day. He's getting stronger. He's lifting his legs. He's been in a wheelchair for 2 years, and he's lifting his legs now, and he was able to open. He's able to open up a bottle.
Okay, good.
My concern is, though, last week my sister called me and said that he's starting to stutter really bad, and he still has really bad leg spasms. Mm-hmm. Is there anything that we can do for him?
Well, what I would do, how much does he weigh?
About 230.
Okay. And he's taking 2 of the healthy heart and brain packs?
Yes.
Okay, good. Well, I would throw in also the Smart FX. I'd give him 9 of those a day. 3 at breakfast, 3 at lunch, 3 at dinner. It'll be 3 bottles a month. And that's designed to give the neurons, the brain cells, the raw materials to make neurotransmitters. And that's kind of where I would go and make sure that he's staying away from all the oxidative stuff. And again, no fried foods, no fried foods of any kind, no stir-frying organic vegetables, no fried eggs, no eggs over easy. Eggs have to be either poached with the yolk soft or soft, boiled with the yolk soft or soft scrambled in butter. No oils, no margarines, any place. No ham salad sandwiches, no tuna salad sandwiches, no chicken salad sandwiches. Anything with margarines, mayonnaise, salad dressings, cooking oils. Canned fish have got to be packed in water, mustard, tomato sauce, not oil. And no gluten, no wheat, butter, and oats. So it's easy to kind of forget and slip into the, well, just, he's feeling better now. Let's, give him a hamburger with a bun. And can't do that, okay? So it's very important to really crank down on that kind of stuff. And it's good for the feedback there that he's actually getting stronger. And but don't wait too long. Give me a call in a week. Give me a call in 2 weeks, and let me know about the stuttering business.
Okay.
Okay.
And then for the leg spasms, you told us to up them to 3 ounces of the osteo or the calcium per day.
Yeah. Either osteo or cal toddy. Mm-hmm.
Okay. And all right, and we did that, but he still has some severe leg spasms. That's why. Is there anything else that we can try?
Let's see here. Yeah, you might put some of that CM cream I'd put the CM cream on his lower back, the lumbar area of his back, because there are several reasons. This could be kind of. Does his leg spasm happen primarily when he lays down, or is that any time?
When she's trying to lift him out of the chair to put him on the potty or trying to lift him into bed.
Okay, so it's a position change.
Yes.
Sets it off. Okay, yeah, it is probably a lower back problem. Maybe that through his ALS he used to be numb, and he couldn't. This numbness almost anesthetized these things, and now as that's getting better, that numbness is gone, and he's actually getting a little peripheral neuropathy. It was just covered. With the numbness because of all the changes in the brain. I've actually seen that when people are paralyzed from the neck down. They didn't have any pain. They were just paralyzed. And then he said, well, I'm getting pain now. Well, that's good because you're actually getting things working and you're receiving messages and so forth. So let's see how it goes another week and so forth. But you can get some symptom relief by putting the CM cream on his lumbar area of his back, not on the legs. Okay, Doug, let's go to callers.
Let's head to Mississippi. And Veronica, you're on with Dr. Wallach.
Well, Veronica, you're on the air.
Hey, Dr. Wallach. I'm calling about my dog that he has canine cognitive disorder or dementia, and he's also got cancer, and he's lost one eye to glaucoma, and we've had cataract surgery on the other eye.
How old is his dog?
He's almost 13. He'll be 13 January 1st.
Okay, and what kind of dog is he?
A Boykin Spaniel.
Okay. Now, are you giving him any supplementation at all?
I started giving him Orthodex a couple of weeks ago, I believe.
Okay, good. And how much does the dog weigh?
43.
Okay, so yeah, I'd give him 2 scoops. It's, 1 per 25 pounds of body weight, but he has all these problems. So I'd give him 2 scoops of the Orthodex per day in his food. I would also give him the Smart FX. I'd give him 3 of those a day. again, for the ability to have the brain give neurotransmitters, and that'll be 1 bottle a month. I would also go ahead and give him the selenium. I'd give him 2 of those seleniums per day. You can either plop them down his throat and rub his little throat, he'll swallow them, or he can open them up and just put them in his food. Okay?
Okay, 3 Smart FX and 2 selenium.
Yes, ma'am. And 2 scoops of the Arthrodex per day.
Okay, I started giving him 4 scoops because I thought he might need.
Well, that's fine. Okay, well, if cost is not a factor there, go for 4 scoops. Can't hurt him. Okay, Doug, let's go to callers.
Let's head to Chicago, Illinois, and Rich, you're on with Dr. Wallach.
Well, Rich, you're on the air.
Hi, yes, I have a friend actually I just met yesterday who has been dealing with quite a few conditions. The main one right now I had a question about was TTP. My question was, I was kind of wondering if probiotics would be helpful for him.
Yeah, you have to tell me what TTP is.
He didn't. He showed it to me on the computer, but I didn't write it down. It was something. It was a thrombotic condition.
Okay.
All right, I'm not sure exactly what it was.
So he's getting thrombosis. He's getting blood clots, maybe in the brain, maybe in the lungs, maybe in his legs, maybe coronary arteries.
It's all over.
All over. Okay. This may be thrombocytic purpura. That's where the P comes in. That may be what it is. And so basically, when this happens, they make excess platelets. Sometimes they don't have enough of the omega-3s to keep the blood cells from getting sticky. How much does this guy weigh?
He's about 200 pounds. He's also got, he has high blood pressure. He's got several other issues as well.
Yeah, well, they're probably all related. By several other issues, are we talking about diabetes or what?
He was diabetic. I guess he corrected that already on his own. He's still got the high blood pressure and arthritis.
When you say corrected, is he managing his diabetes with medication?
He got away from the fried foods and a lot of the bad foods on his own already before I even talked to him, so that was a good thing.
Good, sure. But is he on medication still for diabetes?
I do not believe he is. I don't remember if he said he was or not.
Okay. All right. This is a little complicated one, but Shar, what would you do for a 200-pound guy with symptoms of an omega-3 essential fatty acid deficiency, high blood pressure, and maybe diabetic, at least formerly a diabetic?
Well, he needs to get on the healthy blood and sugar pack.
Yep. We got to run one of those messages, dear. Hang on. We'll let you finish that up after these messages. Doug, let's go right back to Illinois. And Rich, Shar, again, this guy, 200 pounds, has blood clot problems, usually an omega-3 deficiency there, high blood pressure, history of diabetes. What would you do for him?
He's on the healthy blood and sugar pack. He needs 2 of them, but if he's got plugged up arteries and stuff, he also needs the Ultimate Daily. And if he's got blood clots, he needs the Nightly Essence to dissolve the blood clots.
Okay. Nightly Essence has an enzyme in it called nattokinase, which is legendary for dissolving blood clots. You're exactly right. Very good. I'd give him 3 of those Nightly Essence in the morning when he wakes up with a glass of water, and 3 at bedtime with a glass of water. That'll require 2 bottles a month. As you point out, 2 healthy blood sugar packs per month. What would you do for the high blood pressure?
Well, if the high blood pressure is just caused by a calcium deficiency, that'll take care of it. But if it's caused by blocked arteries, he needs the Ultimate Daily.
There you go. Big fella like that, 200 pounds. I'd give him 9 of those Ultimate Dailies a day, 3 at breakfast, 3 at lunch, 3 at dinner. That's going to support maintenance repair of many, many problems, including obstructive artery disease, which may or may not be going on there. We don't know that piece. When somebody says, oh, this guy's got a whole list of problems, let's assume here for a moment, because he has a history of diabetes and high blood pressure, that he does have some artery disease in his kidneys. And you're exactly right. I'd give him 9 of those Ultimate Daily tablets a day, 3 at breakfast, lunch, and dinner, and that would require 2 bottles a month to pull that off. And he's got to change his diet, too. No fried foods, no processed meats, nitrates, nitrites, no oils, no margarines, mayonnaise, salad dressings, cooking oils, fish. You've got to be packed in water, mustard, tomato sauce, not oils, and no gluten, no sugar. Doug did a great Pearls of Wisdom thing today on this high fructose sugary soft drinks increases the risk of plugged arteries and high blood pressure by 50%, and kidney failure by 50%. And so I got to stay away from all that kind of stuff. This is a major lifestyle change for this guy, and it will add many healthy years. There's a tremendous benefit to doing this. And let's see here. We've only got a moment or two left. Shar?
Yes.
What would you tell people? You've got about a minute here or two. What would you tell them to do to prevent all this stuff from happening?
Well, prevention is the name of the game. The Healthy Start Pack is the base program for all people, all humans, and you need to take one Healthy Start Pack per 100 pounds of body weight, and you can avoid getting high blood pressure, diabetes, and all these things just by doing preventative maintenance, which I've done. I'm 70, and I don't have anything wrong with me, and I don't take any prescription drugs. I won't, because in Michigan, they made a law that if you get maimed or killed by a prescription drug that's been approved by the FDA, you can't sue, your family can't sue, you're SOL. So to me, taking a prescription drug is like playing Russian roulette, and my name is Murphy, so I would lose. So I just don't take them. They're too dangerous.
When was the last time you went to a medical doctor for a disease?
It's been over 24 years.
Yeah. Okay, and how long have you been with Youngevity?
24 years.
Very good. Yeah. Okay, well, thank you for sharing that. And you're exactly right. Preventive maintenance is the name of the game. Prevention is the name of the game. And not only can you reduce your risk of every disease you can imagine by supplementing with all 90 essential nutrients and change your lifestyle and avoiding all the bad stuff, but also your kids come along, your grandkids come along, you're going to be able to significantly reduce the risk of birth defects. I mean, we're talking cerebral palsy, heart defects, neurotube defects. We're talking about eye problems. We're talking about things like muscular dystrophy, cystic fibrosis, even Down syndrome. All of these things are actually, in all kind of physical defects and emotional defects, are actually caused in most cases by nutritional deficiencies of the embryos. You get kids going now, and I get people saying, well, I got this friend I know with rheumatoid arthritis who could help him, but he won't try our nutritional programs for it. Well, that's because his whole adult life he's been taking 25 prescriptions a day, and he's locked onto the prescriptions. Start your kids before they're conceived, all through the pregnancy, the development, from the moment they're born. Then if they do need something later on from a vitamin mineral list, guess what? They won't balk. They'll just do it. Thank you, Doug and Billy. Superlative job as usual. Thank you, Shar. Super job. God bless each and every one of you. God bless our troops. God bless our Navy SEALs. And God bless America.